Hi, I'm Dr. Edwards. Today, I'd like to talk to you about musculoskeletal injuries. Many of my patients are older to mid-range adults who still like to be active, and I love that about them. But one thing that happens when you get older is that you do tend to be prone to more injuries. I have patients that have shoulder injuries, knee injuries, hip injuries, ankle injuries. And they often call me and ask me what they should do. Do they need an x-ray? Do they need to go to the emergency department? The answer typically is no. Most injuries are not going to be broken bones, and x-rays are rarely useful unless you're looking for a broken bone. Then they want to know what they should do. Should they take ibuprofen and Tylenol and just play through? And the answer to that is no. I like to tell people, if it hurts, don't do that. Most musculoskeletal injuries really need 6 to 8 weeks of rest. In fact, broken bones tend to heal faster than sprains, particularly ankle sprains. Some musculoskeletal injuries, like ligament tears in the knee, can often require surgery. So if your knee or your hip feels unstable, that's a different thing entirely. And I definitely think you should call your doctor and ask them what you should do. Hopefully that doctor's me, and I'll ask you to come in and examine you that day or the next day, and then decide where to go from there. Sometimes, if people do need surgery, they want to know who's the best orthopedist. Now, while I can't answer that question for you right now, what I can tell you is that a good orthopedist is one that will examine you and will decide whether or not you need surgery based on your specific circumstances. In fact, my favorite orthopedists are the one that will tell patient you don't need surgery, because many things that we've operated on for years aren't actually helped by surgery. And I can help you navigate that as well. Now, one of the most difficult injuries to deal with is actually the shoulder injury. The shoulder is a very shallow joint where the humerus just sits in there a little bit, and there's basically a cushion or a surrounding area of muscle that helps keep the shoulder in place. People frequently dislocate their shoulder or tear ligaments in their shoulder. Most of the time, the dislocation can actually be put back in relatively easily, but then does require at least 6 weeks in a sling. However, if you tear a ligament or something like a slap tear, frequently these will require surgery. And the way that we figure that out is after we do an x-ray, we get an MRI. But what I want you to understand is that no matter what type of musculoskeletal injury, unless it's a fracture, you're probably going to have to let it heal before you get any kind of surgery. And the reason is because it's pretty difficult to operate on a swollen joint. So if you have a musculoskeletal injury and you're concerned about what you should do, first thing, rest. Second thing, ice. Third thing, go ahead and take Tylenol and ibuprofen, but not so that you can do more on it, just more so you can sleep and alleviate the pain. And please, if you have any questions about this, make sure to give me a call, because hopefully I'm your doctor.